Hi, my name is Carlo, and today I will be presenting on botulism, what it is, how it works, and why it is important in healthcare. And today's relevant Bible verse is 1 Peter 4:10. Each of you should use whatever gift you have received to serve others. And this fits the idea that using medical knowledge ethically and responsibly is important to serve your neighbors. So when we look at the signs and symptoms of botulism, most cases actually start with very general, almost vague symptoms. People usually begin by feeling dizzy, noticing their mouth is unusually dry, and they may have blurred vision or double vision. And that vision change is actually one of the biggest early clues because it happens when the eye muscles start to weaken. As the toxin continues to affect the body, we start seeing more abdominal symptoms. Patients might complain about stomach pain, nausea, vomiting, and either diarrhea or constipation, one of the two. And these symptoms can easily be mistaken for a regular stomach bug, which is why early botulism can be tricky to recognize. Infants with botulism look a little different because their nervous systems are still developing. The toxin often shows up as difficulty in sucking, excessive drooling, and drooping eyelids. And parents may notice that their babies just seem unusually weak or floppy. Over time, the pattern becomes very clear. The toxin progressively paralyzes the muscles throughout the entire body. It starts with smaller muscles, like those controlling the eyes and the face, and then moves downward. If it continues to be untreated, the paralysis eventually reaches the muscles responsible for breathing, and that leads to the most common cause of death in botulism, which is respiratory paralysis, when the diaphragm and chest muscles stop working and the patient can no longer breathe on their own. And this is why early detection and treatment is absolutely critical. Botulism is a little different from many other diseases we study because it's not an infection of the nervous system. The nerves themselves aren't actually being invaded by bacteria. Instead, the problem is that the body becomes intoxicated, meaning poisoned, by a very powerful substance called botulinum toxin, or BTX. This toxin is produced by a group of bacteria in the Clostridium family. The most common one is Clostridium botulinum, and these bacteria live naturally in soil and aquatic environments all around the world. And there are a few other species like the Clostridium butrisum and the Clostridium barati. I don't know how to pronounce those, but they're there. That can sometimes produce the toxin as well. In the environment, these bacteria survive by forming endospores, which are like dormant, highly resistant shells. These spores don't produce the toxin, but if they land in the right conditions, which is low oxygen, enough nutrients, and higher pH with a temperature above 4 degrees Celsius, they can germinate and wake up and start growing again and begin producing the toxin. There are 7 known types of the botulinum toxin labeled A through G, but types A, B, and E are ones responsible for most human cases of botulism. What's interesting is that the exact same toxin, when purified, carefully controlled, is used in medicine and cosmetics. In medicine settings, small doses of the botulinum toxin can relax overactive muscles, which helps treat things like chronic headaches and or cervical dystonia. In cosmetic settings, you know it as Botox, which reduces wrinkles by temporarily relaxing the facial muscles. Okay, now let's talk about the pathogenesis of botulism. We're really describing how the toxin gets into the body and how it eventually causes paralysis. There are several different pathways depending on the type of botulism, and they all end with the same outcome: botulinum toxin reaching the nerves and blocking the ability to send muscle signals. Let's start with foodborne botulism. This happens when a person eats food that already contains the toxin, sometimes even from something as small as a contaminated bean. The toxin survives the stomach. No, the toxin survives the stomach and moves into the small intestine and then gets absorbed directly into the bloodstream. From there, it travels to the nerves. Infant botulism works differently. Babies don't eat the toxin, they ingest the endospores. These spores can germinate inside the infant's gut because their microbiota, which is the natural bacteria that somebody has in their stomach, isn't fully developed yet. Once the bacteria starts growing, they produce toxin right there in the intestines, and that toxin is then absorbed into the bloodstream. This internal production is why infant botulism tends to be more gradual in onset. Wound botulism occurs when the Clostridium bacteria gets into the wound, typically a deep or poorly oxygenated one. The bacteria multiply in the dead or necrotic tissue and begin producing a toxin which eventually diffuses into the bloodstream, just like the other types. There is also adult intestinal toxemia botulism, which is similar to infant botulism but extremely rare because the healthy adult gut microbiome usually prevents the bacteria from growing. Lastly, we have iatrogenic botulism, which form doesn't happen naturally. It happens when somebody receives purified botulinum toxin, like Botox, in a dose that is higher than recommended. This can occur in either cosmetic or medical treatments if the injection isn't done correctly. Once the toxin reaches the nerves, its structure explains why it's so powerful. Botulinum toxin is an A and B toxin. The B portion helps it bind to specific receptors in the nerve endings. After it attaches, the A portion enters the nerve cell and then inactivates the proteins that are required for releasing neurotransmitters. But in simple terms, the nerve can't send signals anymore because nerves can't tell the muscles to contract and the muscles become weak and eventually completely paralyzed, a type called flaccid paralysis. So although the routes of entry differ, all forms of botulism cause disease in the same way. The toxin blocks the nerve communication, leading to progressive paralysis. When we look at the epidemiology of botulism, we're really looking at who gets the disease, how often it occurs, and in what situations puts people at risk. Even though botulism can be severe, the good news is that it's actually quite rare in the United States. The most common form is infant botulism, which typically affects babies between 6 weeks to 6 months old. At this age, their intestinal microbiota is still developing, which means they don't yet have the protective bacteria that adults do. Because of this, if they ingest the Clostridium endospores, often through environmental exposure or honey, the spores can germinate and produce a toxin in the baby's gut. This is why honey shouldn't be given to children under 1 year old that are 1 year old or under. Even though it's the most common type, we will see still fewer than 170 cases per year in the United States. Wound botulism is very rare, and it usually occurs in situations involving contaminated deep wounds in the US. The majority of these cases are associated with the use of injected drugs, where the injection sites can create anaerobic environments ideal for bacterial growth. Adult intestinal toxemia botulism is extremely rare. It happens in adults whose gut microbiota is significantly disrupted, usually due to immune suppression or heavy antibiotic use. Because normal adult microbiota usually prevents the Clostridium form from growing. So only vulnerable individuals are affected from that one. Foodborne botulism is another uncommon form with fewer than 30 cases a year. This typically happens when someone eats improperly when somebody eats improperly canned or stored food, like home canned vegetables, fermented foods, or stews left out at room temperature. In these low oxygen environments, spores can germinate and produce toxin inside the food before it's eaten. Finally, the iatrogenic botulism, which is also very rare. This occurs when somebody receives botulinum toxin injections either medically or cosmetically in doses that exceed safe guidelines, often linked to unlicensed or improperly prepared products. Overall, while botulism has several different forms, each associated with different risk factors, it remains a very uncommon disease, especially when following the proper food handling and medical safety practices. When it comes to botulism, treatment needs to begin as quickly as possible because the toxin works fast and the damage can become very severe. The main treatment is giving an antitoxin, and the exact formulation depends on the patient's age. Infants receive something called the baby BIG, which is a specialized immune therapy designed for infant botulism. Anyone older than 1 year receives the heptavalent botulism antitoxin, which covers all 7 types of the botulism bacteria, which is A through G. If the toxin has already affected the muscles that control breathing, which is called respiratory paralysis, the patient may need mechanical ventilation, basically a breathing machine until the nerve endings recover. In cases of wound botulism, doctors also remove the dead or infected tissue to stop the bacteria from continuing to produce the toxin. Prevention is just as important. For food botulism, proper canning, sealing, sterilizing, and food storing can greatly lower the risks. Infants under the age of 1 should never be given honey because it contains spores. Good wound care is critical too. Not injecting drugs or reusing needles eliminates the main modern cause of wound botulism. And as for iatrogenic cases, prevention simply means receiving Botox or the botulinum toxin injections only from trained, licensed professionals. And now, it wouldn't be a GCU presentation if we didn't have to include the Christian worldview. So now, looking at this through the Christian worldview, we can see the bigger picture. Educating others about botulism isn't just scientific, it's an act of service. It protects communities from harm. And in the same way, medical professionals who use Botox have a responsibility to follow ethical and safe practices so their work never causes injury. Both prevention and treatment reflects the idea of caring for others, stewarding our knowledge, and working to protect those around us. It ties perfectly into Philippians 2:4, which reminds us, let each of you look not only into his own interests, but also into the interests of others.